Hi, Assalamualaikum and a very good day. I bid to my Madam Fatira as our lecturer for English Proficiency 2. Our group who had a life-changing event will present about our poster, which is the Anti-Smoking Club. But before we started, I would like to introduce our group members. Our group consists of 5 members, including myself. I am Muhammad Sufi Kushairi bin Zamzuni, and the other members are Nur Hakimi Mahathir, Nurul Atirah, Amira Beatricia, and Zeti Kristina.
Hi, my name is Nur Atir binti Mahmud. My metric number is 294374. We present about introduction of this poster. The topic of this poster is Anti-Smoking Smoking Club. This club was established to create awareness among students and residents about danger of smoking. We want to make our university environment free from smoking. What is smoking? Smoking is a practice in which a substance is burned and resulting smoke is typically breathed into be taste and absorbed into the bloodstream. If you want to know, in United States, cigarette smoking continue to be the largest single preventable cause of death and disability, and it assaulted with a variety of negative health issues. Sometimes smoke represents purification. Most often, it represents the soul leaving the body. Smoke has become the pollution, especially to our air. Here, I have a fact about smoking want to share with you guys. First one is, it increases your chance of dying. The second one is, smoking is not only the killer, but it gives you a serious illness, such as lung disease and also cancer. Why does people start smoking? It is because of parental influence, media influence, genetic factor, and also stress factor. People say smoking can release their stress because nicotine creates an immediate sense of relaxation. So that's why people smoke during their stress time, and it will become addicted.
Disadvantage of smoking. People who smoke are more likely to have certain health issues and get certain diseases compared to those who don't smoke. Some health issues are immediate while others develop over time and have an increased risk of many cancers such as lung, pancreatic, kidney, liver, throat, bladder, and colorectal cancer. Below is more information about the smoking. First is smoking is associated with an increased risk of cervical cancer. Smoking causes more lung cancer deaths in women and men. More women die from lung cancer than any other cancer, including breast cancer. There are more new cases of lung cancer in young women than young men. You can immediately tell if someone has just smoked or been with smokes. Also, they start to become yellow, and smoke can increase the risk of infection that lead to tooth and bone loss. Women who smoke are more likely to have more irregular or painful periods and have low estrogen level, which can lead to mood swings and vaginal dryness. Go through menopause at a younger age and have more symptoms and have trouble getting pregnant. If you do become pregnant, the nicotine from smoking can harm your baby. If a baby is exposed to nicotine during pregnancy, it can affect their development before and after birth. Smoking during pregnancy can cause many problems for the baby, including higher risk of the being born too early, higher risk of serious birth defect like a cleft lip or cleft palate, lower chance of a health birth weight, less likely to have normal brain development before birth and through early childhood, more likely to die from sudden infant death syndrome. Smokers are more likely than non-smokers to get chronic obstructive pulmonary disease (COPD). This disease makes it hard to breathe and gets more worse over time, and this disease more likely to get a young age. Smoking reduces the ability to smell and taste. It affects the taste receptors. People lose their taste buds and overall their lost appetite.
So here are the 5 steps to quit smoking. Step 1. Set a quit date. The first step to quitting smoking is to make the decision to quit. Even if you have failed before, do not let your past hinder your aim. The more times you try to quit, the greater your chance of success. Besides affirming your willpower, construct a plan to help you to stick to the decision. Start by setting a quit date, preferably within the next 2 weeks. This will provide you with enough time to prepare without losing the motivation to quit. If you mainly smoke at work, quit on the weekend, so you have a few days to adjust to the change. On the contrary, if you feel the urge to smoke during the weekend or your workplace does not allow smoking, then any weekday would make a perfect quit day. Avoid a day when you know you will be busy, tense, or have a special event that could be a trigger. Write down your quit date somewhere and look at it every day. The anticipation can help you build your determination. Step 2. Tell the world that you are quitting. Having the public know that you will stop smoking can help to reinforce your determination. So let your friends and family know about your plan and tell them you need their support and encouragement. Your friends can help to distract you from the triggers. Let them know how they can help. Having a quit buddy who wants to stop smoking as well can be a good motivator too. Struggling together help you cope better. Besides that, spend time with people who have succeeded in giving up smoking and ask for advice. Those small talks will be a good motivator for you. Step 3. Anticipate the challenge. As the nicotine from cigarettes provides a temporary and addictive high, eliminating it can cause physical withdrawal symptoms and cravings, so be prepared to face common challenges. Most people who begin smoking again do so within the first 3 months. Hence, it is important to invest in yourself in useful distractions, especially in the first 2 weeks. If you can get through the first 2 weeks, your chance of success is much higher. Sign yourself up for fun, low-stress physical activities. It will not only be beneficial for your health but can also take away your negative emotions. Sweating can also boost your sense of well-being and self-control, consequently reducing your impulsiveness to grab a cigarette. Step 4. Remove smoking triggers. Remove cigarettes and other tobacco products from your home, car, and work. Don't forget to eliminate your lighters, ashtrays, and match as well. Having a cigarette trail is not going to help you either. So wash your clothes and freshen up anything that smells like smoke. Shampoo your car, clean your drapes and carpet, and steam your furniture. Identify and avoid the things that make you want to smoke, whether it's a person, place, and things. Do not stay with smokers and be in smoking place for too long. They can trigger the need to smoke. Instead, spend time with non-smokers or people who have succeeded in quitting smoking. So here is the last step. Talk to your doctor or pharmacist. Your doctor can prescribe medication to help with withdrawal symptoms. Nicotine replacement therapy, for example, increase the rate of quitting by 50 to 70%, but it deals only with the physical addiction to nicotine, not the behavioral or psychological addiction to smoking. So some sort of smoking cessation program and strategy is still important. If you cannot see a doctor, you can get many products over the counter at your local pharmacy, including nicotine patches, lozenges, and gum. Consult your pharmacist for the right product option. Keep in mind that quitting smoking is a constant battle with yourself. Therefore, celebrate every day that goes by without you taking a cigarette. Award yourself for all the little milestone you have reached. Now that you are no longer spending on smoking, pamper yourself with other indulgences that interest you. Remember, you are stronger than your smoking allure.
For your additional information, our club will conduct an event on 18 November 2022. The day is Friday and will start on 2:30 PM until 5:30 PM. Sports Centre, Nathan University have been chosen for the use of the event. We hope many students will join this event because we have a lot of amazing things during the event.
We from ASSC, that means Anti-Smoking Smoking Club, will give many benefits to the people who so interested to join this campaign. We will offer you very interesting things to appreciate your patriotism and support for this program. So, you guys must be eager to know about what we have to offer, right? Okay, so the advantages when you join this campaign is all the participants can join this quiz contest in the end of this campaign, we will give different questions to each participant who participates in this quiz about the content of the program held. The best answer will be given a prize. For sure, we will provide you guys who join this program the international merit. We know this is the most important things that students often ask and really want to know about it. Next, we also provide a free lunch for all of the participants who join this program. The reason why we give a free lunch because we really excited to appreciate the participants and celebrate between the club members and the general participant. Last but not least, we provide the prize for the participant who join interesting activities throughout the program. High chance to win the prize. Don't forget to grab it. Okay, for your information, we do this campaign for the students and university residents not just to hear about smoking talk alone, but we aim for this program so that the relationship between all students and university people can work together to raise awareness about the dangers of smoking amongst ourselves and the community in this country. It is our hope that you will all be excited to participate in this program that we are organizing along with the attractive offers to the following participants. Hopefully, this program on health can provide something best for students, university residents, and the surrounding community. Before I ending my session, our club welcomes all participants to join our club by scanning this QR code to register as a club member. Lastly, we did not forget to deliver our club slogan. Just quit smoking, eliminate cigarette, not happiness from your life. I think that's all from me. Thank you.